Hi, welcome to our presentation today on healing your leaky gut and restoring your digestive health. I'm Dr. Lily Woods, PhD. I'm glad you joined me today. I am a biohacker and a scientist, and we're going to dig into the molecules that drive your digestive health wild and a lot of autoimmunity problems because of it. And let's just dive right into our presentation. So let's talk about the problem of gut health in America. Our microbiomes in the US are way out of balance, much more so than a lot of the other countries in the world. And it's thanks to the standard American diet. Health begins with the lining of the gut. Most weight loss and health improvement efforts fail because of the lack of knowledge of the core thing that needs to be handled first, which is healing our guts. The issue of chronic gut health leads to so many chronic health issues and is a core reason we see so many autoimmune diseases. So let's talk to the impacts of our gut microbiome. Education about the problems with the American food ecosystem is essential. Our immune system, cognitive functioning, and the nutritional balance of our bodies is controlled by our gut health. It directly impacts and creates autoimmunity. The breakdowns come from a multitude of factors, whether it's the food we're eating and the chemicals that are on those foods, preservatives that are sprayed on or added to almost every product, to stabilize it on the shelf, etc., preservatives, etc., creates autoimmunity. Chemicals in our water and the foods that are in our bodies, we cannot remove them, and they get stored in our body fat. Sometimes those molecules are really big and our system is just not set up or trained on how to remove them. And even our detoxing efforts prove futile to get these elements out of our body. And one other very important factor that we need to talk about is stress. We are under stress on a daily basis at rates that are exploding, with access to news on the internet and our phones all the time, and mental, physical, emotional, chemical, environmental stress has just peaked in our generations and our decades. Our human system is exposed to these stressors every single day. So we've talked about three things in this slide that I'm going to come back to that you need to pay attention to: gut microbiome, detoxing, and stress. Three of the core things that if you don't handle every single one of them, you cannot be successful with almost anything you're trying to do to handle disease, lose weight, etc. So let's talk about the great gut-brain axis. So the blood-brain barrier, BBB, which we'll be talking about a little bit more in detail later, really talks about how the gut and the blood barrier and the brain are connected in this system. There's metabolites produced by the gut microbiome that travel right through the blood and impact our brain. And it's also bidirectional, where the brain produces neurotransmitters and chemicals, and that travels right back down and impacts the gut. So this axis being bidirectional is very important to understand. And then also the four systems that are involved, one being the enteric nervous system, the ENS, the brain neurons in our gut. A lot of people have talked about the brain in our gut and having gut feelings and all these different things, but it's actually been proven that there are neurons in our gut. And then our autonomic nervous system. That is the system that stays awake when we're sleeping. All of the different systems that operate, one being digestion. And then our neuroendocrine system, which is the system in our brain, our thymus, our adrenals, our pineal, everything that's producing all of those neurochemicals and transmitters in our brain, and the hormones that are very, very important for our daily functioning in life. And the central nervous system, the communicator to all of our muscles and systems in our body, and another system on top of all of that. Our human bodies are incredibly complex. The microbiome secretum affects the health of neurologic system health as well as digestive health. If you think about serotonin, melatonin, and delta sleep-inducing peptide, DSIP, they're all produced in the gut, and they travel up to the brain. And there's also something that happens in the circadian rhythm the hormonal rhythm that's aligned to the day and night structure of our bodies. All of these metabolites talk to each other, they communicate with each other, and are dependent on each other. The brain can equally determine the microbiome by influencing the GI functioning, intestinal mobility, mucus secretion, secretory functions, blood flow, etc. So they're constantly talking at this back and forth in this axis. Gut inflammation equals brain inflammation. And there's a lot of issues on both sides of that. So let's talk about leaky gut. What is it? It's also known as increased intestinal permeability, and it's a condition in which the lining of the small intestine has been damaged, and it leads to gaps in the tight junctions that regulates what passes through the intestinal wall. So you can see in this picture, in the middle, you'll see a tight junction, and that's mediated by proteins and different chemical structures that tightly bind those together. And when it's broken, it leads to a barrier. And really large molecules like toxins or chemicals can pass right into our bloodstream. You can see it goes from the top to the bottom in the picture, with the top being our gut and our intestinal space, and the bottom being our blood. When it goes right through, we have all kinds of issues created because it's not filtered. It's just like the air filter in our furnace isn't working, and all of a sudden we have all this dirt that we're breathing in. It's the same type of thing. So intestinal barrier dysfunction is a key feature of leaky gut. The gut lining is designed to selectively allow nutrients and beneficial substances to pass into the bloodstream, and while keeping harmful substances out. It doesn't happen that way in leaky gut. The barrier is compromised. When you have tight junction disruption, the protein complexes that seal the spaces between the intestinal cells are damaged. They're weakened, and they allow larger unwanted molecules to pass through. It also hyperactivates our immune system. The immune system may recognize that leaked substances as foreign invaders all the way into our blood. It leads to inflammation, allergies, and autoimmune reactions because our body thinks we're under attack. These foreign things are getting into our systems, and it's on high alert trying to go out and fix these problems. So it creates a lot of problems in our whole system. So here's just another picture of our intestinal barrier health. There's symptoms, there's causes, there's tight junctions, there's restorative approaches, and the intestinal barrier and repairing that is what we're all about with this. Once again, what are you eating? What's going in? How many chemicals are going in? How much stress are you under? And are you allowing these nutrients to get through that shouldn't be in? And then also understanding how chemicals and medications are impacting your system. Some of them are really harmful to those gut barriers, and you should be prepared and ask questions when you're, taking medications to make sure you understand the systemic influences of them. Okay, so let's get into what symptoms we have with leaky gut. This is universally recognized as a medical diagnosis, and it's often associated with symptoms like chronic fatigue, abdominal pain, bloating, diarrhea, food sensitivities or intolerances, joint pain, skin issues like eczema or acne, brain fog, or mood disturbances. And if you think about chemicals being in your brain that don't belong there, or things in your system that don't belong there, it makes sense. Our body's confused. It doesn't understand what's happening. Conditions that are linked to leaky gut, and a lot of these are still being studied, but it's a contributing factor to autoimmune like lupus and rheumatoid arthritis, IBS, inflammatory bowel disease, food allergies or intolerances, and chronic fatigue syndrome, just to name a few. And you see in this picture how many different systems that are actually being influenced by the systems associated with leaky gut. So there's a lot of potential causes of leaky gut. Chronic stress is a strong one. If you have a lot of stress, if you feel a lot of anxiety in your life and prolonged stress, it can affect the gut barrier function. Your diet, if it's high in processed foods and sugars and alcohol, that also contributes. Medications, NSAIDs, antibiotics are very disruptive to the gut lining. And a lot of other treatments are as well. Just like I mentioned before, be aware of your treatments and the side effects of those. Dysbiosis is imbalances in the gut bacteria, which weaken the gut barrier. Um, and so these things can be tested, but you know better than most how you're feeling on a daily basis, and that's a really good indicator as well. Chronic inflammation, Crohn's or celiac disease are linked strongly to leaky gut. Just discomfort in your gut. If you feel it and it's not identifiable and it's chronic and consistent, then you should really be aware and try to fix that digestive health. Environmental toxins, pesticides can also damage the gut lining. In our country today in the US, almost every person tests positive for glyphosate, which is Roundup, because it's on or in almost every grain. It's put on our crops, our cattle and other animals eat grass, etc., that's been treated. And it's almost impossible to not have that in your system. And it's very, very difficult for our bodies to remove that chemical. So how do we modulate leaky gut? The brain and other influences on the total gut environment result in a situation that's not conducive to the growth of a particular organism, or it's only partially or temporarily able to restore or improve fluctuations in a healthy microbiome. So what do you do about that? When our systems aren't able to get the different molecules and build the different systems, or there's things in the way, that are complicating our system. And if you look at the picture, it's very interesting to me. I like this picture because it talks about the vagus nerve, which is a mediator of the autonomic nervous system, and stress. The vagus nerve has two different components. One is autonomous nerve, parasympathetic and sympathetic channels. Your parasympathetic is your autonomic nervous system, what stays awake when we're sleeping, your breathing, your heartbeat, your digestive, all these things are still there. And then the sympathetic. So if you're under a lot of stress, so you're constantly emotionally reacting to your environment, et cetera, that's a sympathetic. And that's also mediated by the vagus nerve. So if you get upset, something happens in your environment, your heartbeat might raise, et cetera. They're all connected. And these things cause systemic inflammation. So stress really needs to be handled and mediated for you to be healthy. We're talking about efferent and afferent, the same thing, parasympathetic, sympathetic, all mediated by the vagus nerve and the gut-brain axis. They're tightly coupled. Peptides have been proven to heal the junctions in your gut and also break up biofilms. And that's a whole separate topic of biofilms in your gut and in your bodies. But these are films that kind of build around certain structures, and they're very impermeable and cause all kinds of problems. But there's ways to break those down and get your system functioning better. You want to make sure that your antimicrobial effects are not exposing you to toxic molds, or not allowing your system to break that down. Bacterial viruses also have anti-inflammatory effects on the system. If you have a bacterial virus, you're going to have inflammation. But then again, if it's fighting it, it's going to be fighting that inflammation. So that improves your brain-blood barrier integrity. So let's talk a little bit about gut health programs that we do here at Body Harmonics. So some of the peptides I want to talk about here are BPC 157. Now, if you're looking at the biohacker world, every single peptide therapist, biohacker, et cetera, will talk to you about body protection compound 157. This complex is made from the same components of your digestive juices, and it's one of the most healing and all-encompassing, pure, multifaceted peptides that you can introduce into your system. It supports tissue healing, musculoskeletal injury healing, joint issues, gut-related conditions. It affects collagen formation and angiogenesis, which is how your blood vessels and other tissues are recreating that system. And a lot of the systems here, you have a duration of 12 weeks on, 4 weeks off. And the reason that you have a titrating system like that is because you don't want to oversaturate your system. So you do a 12-week on protocol and then 4 weeks off for your system and your receptors to clear out, and then start, at re-entering that into the system to keep that going. KPV is also another really strong peptide. It has potent anti-inflammatory and antimicrobial properties. It's used for gastrointestinal, skin healing, and mucosal repair. It is very good for treating inflammatory bowel conditions like Crohn's and ulcerative colitis. For a KPV treatment, you would do 60 to 90 days based on your inflammation severity. Or I've noticed a lot of people that have sickness, et cetera, that they are healing from. It's also very good for that. Thymosin alpha-1, TA1, very strong peptide that's a very potent immune modulator. It enhances your T cells. So if you are sick, if you are fighting anything, it's going to enhance your T cells. So they're going to go out and fight whatever it is. And it is broad spectrum immune support. It's used in chronic infections, immune compromised patients, and some autoimmune diseases for immune regulation. For that, you want to do 12 weeks on, 4 weeks off, and then work into a maintenance program that's maybe 2 times per year to supercharge your immune system or clear out anything that's in a problem state. Thymogen beta-4, TB500, TB4-FRAG, which is a smaller aminopeptide chain, which is very powerful, inhibits NNMT. This leads to an increase in fat loss and preservation of your muscle mass. And it mimics a hormone that's currently created in the thymus. And this is used very often with weight loss programs, but also in gut health programs. Your duration is 4 weeks on, 4 weeks off, and then you work into a maintenance program 2 times per year of 12 weeks on, 4 weeks off. So those are some of the things that we do at Body Harmonics to help with leaky gut. There's all kinds of other ways, depending on your symptoms, to work with these systems and understand what's happening in those systems, and what you can do to help them. So thank you for joining me today. I'm Dr. Lily Woods, and it's really been a pleasure talking to you about healing your leaky gut and why gut health is so important. We'll be having many more presentations on different topics, and thanks for joining me, and look forward to seeing you in the future. Thanks.